Hi, my name is Keith Ryan. I'm a chiropractor in Tulsa, Oklahoma. I wanted to talk to you about back pain. And back pain can be really one of two things, one of three things. I mean, there's your upper back, the part below your neck that comes before your lumbar vertebrae. There's your lower back, which includes your pelvis and your back, and sometimes even leg pain. Now, people will all include that in back pain on there. So I'm gonna start with just a little quick anatomy here of what's going on. Your full spine has 24 movable vertebrae, and that includes your cervical. There's 7 in your cervical, 12 in your thoracic, 5 in your lumbar, and your sacral segment has 5, but they're fused together, so they really act as one. On the side of that, you have your pelvis, and you have sacroiliac joints that come off the hip. Now, you can have back pain for a number of reasons. If you slept or turned or twisted or worked wrong on the computer, that'll ordinarily affect your upper back, and you'll get that pain that's between your shoulder blades, or you'll get some rib pain. I mean, you can do a number of things that'll cause that, from lifting to turning, twisting, to stretching wrong, that'll affect that upper back, and that'll have problems. Lower back pain, you can have that from lifting, from turning, from sleeping wrong, from being in an accident. You can have some arthritic pain that'll start to cause pain because the joints aren't moving for a long time, that they actually start causing arthritis. You can get wear and tear on your discs, both in the thoracic area and the lumbar area. If it's in the lumbar area, you can start getting pain down your leg, up in your hips, through your sacroiliac joints, that sort of thing. So what does a chiropractor do to correct those? Well, what we do is we realign the spine so that the joints are functioning properly and it's not irritating the nerve. And we do that through a number of different techniques, and I'll do it through different techniques depending on the person and what's going on with them, on how I'll adjust them, or how I want to actually move that vertebrae that I'll think will be the best way. So I'll pick a technique for that particular person, and I'll move that vertebrae according to what their problem is at the time. Other things I'll do is different physical therapy modalities to bring down swelling and inflammation so that the person can get better. If you have a joint that's really irritating, there's a lot of swelling in there, it's best to try to get some of that swelling out. It helps the joint move better, makes the patient feel better, and it helps them all in all get better faster. So we'll do that type of thing. We'll have them do ice at home. We'll teach them exercises to help get them better, and not only better now, but better in the future, so it doesn't reoccur later on when it, should they do something. So we'll try to do all those sort of things, manipulation therapies, exercises, common sense things. I mean, even as much things as what they're eating, and that if they're eating things that we think are hurting their back, we'll kind of tell them some things that will help them improve a little bit along those lines. Hope this gives you a little information about back pain and things you can do. Thanks so much.